Okay, so now we're going to go over some classic presentations, and these are found on page 580. And so for all of these, think about patient comes in, and then think about the first thing that comes to mind. And that should definitely help you on step one. So abdominal pain, ascites, and hepatomegaly. What are we thinking? It's Budd-Chiari syndrome. And that is posthepatic venous thrombosis. Next one, Achilles tendon xanthoma. That's familial hypercholesterolemia. Adrenal hemorrhage, hypotension, DIC. That's Waterhouse Friedrich syndrome. Okay, next one. Arachnodactyly, lens dislocation, aortic dissection, and hyperflexible joints. That's right. It's Marfan syndrome. It's a fibrillant defect. Athlete with polycythemia. That's when you want to be thinking about an EPO injection. Back pain, fever, night sweats, weight loss. There's a lot of things. But you can also think POTS disease. Remember, POTS disease is pretty much just TB, but it's in the vertebrae. Bilateral hilar adenopathy and uveitis. Remember, this is going to be sarcoidosis. This is sarcoidosis because sarcoidosis can hit almost any organ, but most likely likes the lungs. Blue sclera. This one should be pretty easy. This is osteogenesis imperfecta. It's a collagen defect. Blues line and gingiva. These are lead lines, okay? Because the lead takes the place of calcium. Bone pain, bone enlargement, arthritis. This is Paget's disease of the bone, okay? It's increased osteoblastic and osteoclastic activity. Bounding pulses, diastolic heart murmur, and head bobbing. Head bobbing. This is aortic regurgitation. Remember, the blood will come back into the left ventricle, and you'll get an increased stroke volume causing all these things. Butterfly facial rash, Raynaud's phenomenon in a young female. It's pretty easy. It's SLE. Okay? What's the other thing we could be looking at? We might see that later. Coffee lot spots and Lisch nodules. It's neurofibromatosis type 1 or type 2. Type 1 has pheochromocytopenia and optic gliomas. Type 2 has bilateral acoustic neuromas. If you have the same spots, polyostotic fibroid dysplasia and precocious puberty, you want to be thinking about McCune-Albright syndrome. Okay? That's what you should be thinking. It's a mosaic G protein signaling mutation. Calf pseudohypertrophy, then you want to be thinking muscular dystrophy. Okay? Especially Duchenne's dystrophy. It is a X-linked recessive deletion of the dystrophin gene. Cherry red spot in macula. Okay, cherry red spot. Hold up. Cherry red spot. That's going to be either Tay-Sachs. There's three things it could be. It could be Tay-Sachs. It could be Niemann-Pick. Or it could be a central retinal arterial occlusion. This is because the choroid artery also has cherry red spot. Chest pain and exertion is angina. Okay? And you have unstable vertigo. Chest pain, pericardial effusion, friction rub, persistent fever. This is Dressler syndrome. Remember, 6 to 8 weeks after an MI. Antibodies against the pericardium. Child use arms to stand up. That's proximal muscle weakness. That is Duchenne's. And this actually specific thing is called Gower sign. Child with fever and a slap cheek rash that spreads to the bottom of the body. That's parvovirus B19, okay? It can also cause arthritis and hydrops fetalis. Chorea, dementia, caudate degeneration. That's going to be Huntington's, okay? Remember, Huntington's is when you have a bunch of CAG repeats, okay? Chronic exercise tolerance with myalgia, fatigue, painful cramps, and myoglobinuria. That's something called McArdle's disease, which is muscle glycogen phosphorylase deficiency. Cold intolerance. First thing you should be thinking. Hypothyroidism. So your basal metabolic rate is low. conjugate lateral gaze palsy, horizontal diplopia. This is going to be internuclear ophthalmoplegia. Okay, and remember, this can be due to a couple things. Well, it can be due to stroke. Okay, if it's stroke, it's going to be unilateral. If it's bilateral, it's going to be multiple sclerosis. Remember, if you have loss of the medial lateral fasciculus, then you're not going to be able to move your lateral rectus on the opposite side of your gaze. And finally, a continuous machine-like heart murmur is going to be, this is your pulmonary artery, this is your aorta, it's going to be an open PDA. This is a machine-like murmur because the pressure in this artery is always higher than this one. Thank you.